Hey everybody, Greg Crawford here, your favorite health and Medicare broker. And I wanted to make this quick video to discuss basically like where we're at with healthcare today. As of today, we are in the end of April. It's April 29th, 2024. And there's a lot going on with healthcare. Specifically, I want to talk about the under 65 market, folks that have individual healthcare under 65. And what I'm seeing across the board, there's definitely a strain on the healthcare system. I think that's pretty evident if you've been paying attention. Right now, I'm seeing that doctors, doctor groups are beginning to move away from actually accepting a lot of under 65 clients, patients, and are trying to move more into the Medicare space, meaning they want to deal with Medicare people and bill Medicare, probably because they're able to bill Medicare and get much probably bigger payouts. It's probably easier to bill Medicare, it seems like. The under 65 insurance companies right now, from what I'm seeing, it seems to be overstressed. The system is definitely broken and needs to be fixed. It's just, I could see it. Premiums are going up. Deductibles, medical deductibles are sky high. So you might be paying for your health insurance, but you're still going to have an outrageous amount of out-of-pocket expenses if something medically happens. So where do we go from here? Well, I think number one, the best thing that we can all do right now is really focus on our health. That's what it comes down to. The less you have to see doctors, the less medications that you have to take is going to help you in the long run. So let's first talk about that. And, I understand as much as you want to take care of your health, things are still going to happen. You're still going to have health issues that you need to see doctors and you need to take medications for. But what can we do to prevent more things happening? Or maybe, are you taking a medication that you could possibly come off over a certain period of time just by just making some lifestyle changes? So, number one, when it comes to improving your health, the biggest, obstacle I get from people is that it's, food prices right now are through the roof. That's obvious. And it's expensive to eat healthy. So what I want to do is just cover some low cost ways of improving your health, eating healthy, and taking care of your body so that, we could possibly not have to spend as much time in hospitals, in front of doctors, and getting medications. So number one, hydration. Hydration is huge. The first thing you could do is start drinking more filtered water. Again, make sure it's filtered water. If you're trying to save money, spend less money on getting expensive bottled water in these supermarkets and get some type of low cost filtration system for you, whether it's a Brita that you can just change out the filter, but you need to start drinking a lot more water. Your body is made up of almost 80% of water. So if you're not drinking enough water, you're going to be in a constant state of dehydration and things are going to start breaking down. So that's number one. Simple, inexpensive. Number two is exercise. What can you do for exercise on a daily basis? So if you have physical ailments, physical issues, joint pain, things like that, there's low impact things that you can do on a daily basis. It might just be walk. If you could walk every day, that's going to make a huge difference. Stretching, some type of low impact Pilates, a little bit of body weight strength training goes a long way. And there's a lot of resources out there for you, a lot of free resources too. So trying to get some form of exercise in every day. The other thing is when it comes to food now, making sure that you're eating less processed foods. A lot of the food that we buy that are packaged, they have ingredients in there. And if you could look at everything that you're eating, you should always look at the labels and the ingredients. And where you want to look on the label is at the very bottom in very small print. It'll say other ingredients. And when you look at that, you're going to see a lot of things that you're not going to recognize. Those are the things that over time can damage your body and processes in your body. So you want to make sure that whatever you are eating, try to eat a natural form of it, whether it's more fruit, more vegetables. If you want to get more affordable fruits and vegetables, I suggest going to local farmers markets. You're going to get a much better deal than in like the big box chain supermarkets. So, go locally to a local farmers market. Costco is also a great idea to shop at. So you can buy in bulk. You're going to beat the prices in a regular supermarket if you go to Costco. So that's the next thing. The next thing too is keep your diet simple. So, just pick like for dinners, like 4 or 5, good, healthy dinners, some type of fish that you might like, whether it's like an organic chicken, a salad, pick foods and keep it simple. So, for instance, for lunch, I eat almost the same lunch every day and I keep it very simple. And I buy these fish in the supermarket. They come packaged sardines and mackerel. Sardines and mackerel are super high in healthy fats and protein. They come in like an olive oil package, nice and fresh. I like them. They taste good and it's super healthy for you. And I pretty much eat the same thing every day just because, you know, I just want to make sure I'm putting the best possible source of fuel into my body, which you should do too. I rarely get sick, rarely go to the doctor. What I do keep up on are my preventative stuff. And that's what I would recommend too, is keeping up on your preventative care, your screenings, things like that, to avoid something major happening. And then as far as, your healthcare goes, now as far as your healthcare goes, what I suggest is creating a small savings account. If you can somehow save money on your monthly insurance premiums every month, even if you have a high deductible, you know, pay the least amount monthly to the insurance company, and then use a savings account and just put an extra couple of bucks in each month into that savings account and let it grow. Right now, savings accounts you could get 4 to 5% interest on, and that should be more of like your out-of-pocket medical expense account. So if you do have to like get a surgery or you do have some out-of-pocket medical costs, you can use the money that you have saved there versus, paying higher premiums to these insurance companies. The other thing too is when you're choosing your doctors, there's certain doctors, big medical groups that just like to bill the insurance companies for everything that they could possibly bill. So really pay attention to when you go to the doctor, what kind of notes they're taking down, how they're billing things. It's good to kind of get involved with that as much as you can without, getting too involved. But you want to know like, how the process is working and what your doctors are billing these insurance companies for. Because a lot of times what I see is someone will come to me and say, Greg, this insurance company is terrible, blah, blah, blah. They're not, you know, they're not covering me for this. And a lot of times it has to do with the communication from the doctor's group to the insurance company because they're just trying to build these insurance companies because they have a lot of overhead. They have huge liability insurance premiums that they have to pay. So of course they're going to try and build the insurance companies for as much as they can. But there's other doctor groups now that are moving more towards a value-based care system, meaning they get paid when they see their patients improve their health, when they stay on top of their patients as far as their, keeping track of their preventative care and reaching certain health parameters. So there's two different business models. So what I'm seeing something good happen with these value-based groups. So pay attention to that, especially in the Medicare years. There's more, it's more being used in that group than the under 65. Again, the under 65 right now, it's a tough situation with health insurance. I'm personally seeing it as well. So that's that. And then finally, what I want to say is just like for your own mental health as well. Mental health is going to affect your physical health. So what are some of the things that you can do to improve your mental health, keep yourself calm, keep yourself in a good headspace, whether it's focusing on your spirituality, maybe doing like a 5 to 10 minute meditation every morning. There's plenty of meditation apps that you can use, going on daily walks, speaking to somebody who, lifts you up, being around the right people, removing toxicity out of your life, whether it's a toxic person, whether it's a toxic environment, toxic foods. So that's my big message today. Okay, is remove the toxic things out of your life systematically, little by little. Only put into your body, into your mind, what's healthy. Enjoy your life on a daily basis. Find some type of joy every day, even if you're working all day. Go out, go for a walk during lunchtime. Think about what you're grateful for. Life is short, so you need to enjoy it. We need to keep ourselves healthy. We need to stay out of the hospital, stay out of the doctor's offices as much as we can. Obviously, things come up and it's, some unforeseen things happen. But again, take care of yourself. And if there's anything that I can help with besides health insurance and Medicare, I do have a health background for many years, so I'd be happy to walk you through if you need any advice on food and exercise. I can help you with that as well. And I'm here to help. Okay, so enjoy the rest of the day. I hope you got a little bit out of this video. I just wanted to send you something besides health insurance information, kind of let you know what I'm seeing out there and different ways to lower your healthcare costs and improve your health. All right. So looking forward to speaking to you again.